Okay, let's try this again. It's Tuesday, June the 22nd and everything. We got the mic on now and the whole bit, so let's go with it. We regretfully do have 7 additional deaths, but unless we have something that wasn't reported or didn't get to us yet and everything, it's still progress, but it's still tragic. And so I can't say enough, for us to only have 7 deaths in the last few days, that's probably really good. But for those 7 and those families and all their loved ones, it's tragic beyond belief. Please just join all of us to make sure they're not alone and keep them in your prayers in every way. The 2,864th death in West Virginia is a 73-year-old male from Wyoming County. The 2,865th death is a 44-year-old male from Kanawha County, 44 years old. The 2,866th death is an 84-year-old female from Raleigh County. The 2,867th death is a 62-year-old male from Berkeley County. The 2,868th death is a 78-year-old female from Jefferson County. The 2,869th death is a 76-year-old female from Harrison County. The 2,870th death is a 76-year-old male from Raleigh County. Please join Kathy and I, absolutely, in prayer for all these great people. We've lost a lot of people in West Virginia. 2,870 people. I mean, let's just hope and pray that we never have another pandemic, but we will always be ready. And just think, it's just unbelievable to think that we've lost 2,870 people. Really, really, really sad. Our daily positivity rate is at 1.62 with 245 new cases since last Thursday. Our cumulative rate is at 5.05. It's dropped a good little bit more. That's all good. Our active cases are 2,083. We're on the verge of being below 2,000 active cases, and that's really good. We have 158,000 plus that have recovered from this dreaded killer. We have 100 people that are hospitalized in West Virginia, and that's really good too. But 37 of them are in the ICU unit. And so the numbers, while the numbers still look good and everything, there's nothing that could look much better than this right here. We have no red counties. We have no orange counties. Look at the green. We only have 1 yellow county and 1 gold county in the entire state of West Virginia. I mean, it's been a long time, hasn't it? A long, long time. A long time to have seen something that's that good. The outbreaks in West Virginia, and I want to read this to you, per DHHR, there have been no official COVID-19 outbreaks in schools, nursing homes, or congregate settings since June the 11th. That's really good. Really, really, really good. Reminder always about if you're 65 and older and you feel the least bit bad, please just go get a test. We're trying every way in the world to save every life we can. If you'll go get a test and you're 65 and older and you would happen to come back positive, the antibodies will absolutely take care of this. Absolutely. Come on. Try every way to, if you feel the least bit bad, just go take advantage of all of our free testing and get a test. All the eligibility, 12 and older is all there. We urge everybody, don't forget your second shot. The way to be totally immune from this thing, or as immune as we can possibly get you, we got to have both the shots on Pfizer and Moderna. The face covering requirement ended. It ended on June the 20th. As far as a requirement, it is over. I signed an executive order to make it official. We are no longer required to wear a mask at public property. And this means that all the COVID-19 restrictions are officially lifted. But also remember, the businesses that are out there are private businesses. They can require you to wear a mask, and I also urge anyone that is really concerned and everything, if you choose and you want to wear your mask, wear it. Absolutely, it will give you another little added protection and everything, but what we urge you to do more than anything is get vaccinated. I got to say this, I really am. I mean this when I say it. I mean it from the bottom of my heart. I give the good Lord credit for all the good ideas I come up with, and I'll take credit for the bad ones on my own. But this is a good one. We drew names through the lottery and everything, and we gave away a lot of stuff on our state's birthday just the other day. And we had a great big drawing, and there was a lady that won $1 million. There's a couple of beautiful trucks that got given away. There's a couple of beautiful young kids and everything that got 4-year scholarships, 4-year full ride scholarships to wherever they choose to go to school in West Virginia. My goodness, and all kinds of other stuff. And it was great. It was absolutely just great. So, if you've been vaccinated, you're in a drawing, aren't you? You're in a drawing. If you have not been vaccinated, you may say, well, I'm just not in the drawing. I don't want to be in the drawing. I'm not going to get vaccinated. I'll say it one more time. If you are vaccinated or you get vaccinated, all you got to do is register and you're in the drawing, right? For those that aren't vaccinated, do you realize you're in a drawing too? You're in a drawing absolutely with folks. It's life and death. And right here's the drawing you're in. You're in the drawing, that I lead off with every day. Right there's the drawing you're in. And so we're all in a drawing. Those that have been vaccinated and myself, of course, we in the governor's office can't be in the drawing, but I have been vaccinated. But if those that have been vaccinated are in a drawing for prizes, and they feel really, really confident, as I do too, that now that you've been fully vaccinated, you're not going to get COVID. The likelihood is very rare. And then if you did get COVID, the likelihood of hospitalization, even more rare, and the likelihood of potential death, really rare. But those that haven't been vaccinated, you're in a drawing. Right here's your drawing. 7 of these people died. Every day that I'm here, when I come to do the briefings, I read a list of people that have died. That's your drawing. That's your choice. We're begging you to go get vaccinated. Begging you. And absolutely, but that's the drawing that you're in. It's a crazy choice in my book. We had to do it for baby dog sweepstakes and everything, that we gave away the stuff and everything on our state's birthday. It was fantastic. We had a beautiful lady that ended up with $1 million, and she said to me, you'll never know. You'll just never know how important this is right now and how needed this is to our family. We had, like I said, a couple of beautiful trucks given away. We had a couple of young ladies that won 4-year scholarships to our institutions, a lot of other things, lifetime hunting license, lifetime fishing license, custom hunting rifles and custom hunting shotguns and just a lot of good stuff. It was hot. Now, don't you think that it wasn't hot and everything. And we probably were in the hottest place in West Virginia on that day. And so for all those that came out, we had a great crowd and a lot of fun and everything, and a great celebration of our 158th birthday. You know, it was really good, really, really, really good. We're going to continue to draw every week, and if you haven't been vaccinated yet, go get vaccinated. I mean, there's 290,000 people that have registered so far. It only takes a second to be registered. There'll be a second drawing, you know, on next Wednesday, June the 20th. You can be in the drawing. You can protect yourself. I'm sorry, on June the 30th. Please forgive me. The second drawing will be on Wednesday, June the 30th, and we will continue to draw every week with the last drawing on August the 4th. Now, all you got to do, all in the world you got to do is go get vaccinated. If you've been vaccinated, all you've got to do is just register. Once you get vaccinated, all you have to do is register. It'll only take you a minute to do that, you know, and you'll be eligible for these wonderful prizes. And not only that, you'll be saving your life or changing another life. And, you know, but you know, I even said that wrong, Nathan. It's save a life, change your life. And so with that, you know, please consider to do that, and it'll help all of us. It seems like I forgot something there, but I'll just keep going. I'll remember it here in a second. But, you know, to our young people that are 12 to 35 years of age, please, 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 parents, grandparents, aunts, uncles, whomever it may be, help us get those kids vaccinated. You know, I did want, well, never mind, I'll just keep going. You know, we have an 85.5% administration rate, first and second doses. I do want to say this, that the folks that are over age 65, we're now at 85.9%. Remember, we were trying to get to 70, then 75. Then I said, no, we're going to get to 85. We're at 85.9%. That's all wonderful. Now, there is a little bit of disconnect here. We're at 76.4% of 65 and older people that have one shot. I'm sorry, that have both shots. We have 85.9 that have one shot. So we got that delta, and the only thing I'll remind you is just go get your second shot. If you're 65 and older especially, go get your second shot. You got to do that. Of the people that are 50 years of age and older, 77.7% of them have been vaccinated one time. That's really good. Nearly half of our total population, well, you know, wait a minute. 51.8% of our total population, 51.8% of our total population, 12 and older, have been vaccinated, and that's really good. Have been fully vaccinated, and 62.4% have had their first shot, and that's good too, really good. As far as manufacturing, our businesses and our church outreach, if you'll just call us, we'll come running, we'll set up, we'll do your congregation, we'll do your employees, all that's good. All the information on the vaccine info line is up there. You know, you can go there and get any kind of information you need. As far as our free testing, you know, we thank Walgreens, Fruit, all that for all that they've done and everything. It continues to be free. Take advantage of it. We only have 3 outbreaks in our long-term care facilities, 3 outbreaks in our church community in 2 counties. That's in Monroe and Nicholas County. At corrections, we only have 2 inmates and 7 staff people, you know, that have this, that have COVID now, and so all that's good stuff. We encourage you again to give blood, to give plasma. It is so important. Now, I got a couple other things here that I want to go through that, you know, one of them is a memory that tomorrow is June 23rd. And June 23rd will sit with me forever and ever and ever. It's when the flood of 2016 happened. You know, it marks the 5th year anniversary. You know, when the waters finally did drop, we had 23 people that were dead. We had thousands of homes damaged. We declared a disaster in 12 counties. We had 123 bridges that were damaged and 5 were completely destroyed. We had flood waters that closed 250 roads and pavement washed out on 1,300 separate sites. Let me tell you how powerful the water was. I know that people saw this in lots of places, but I couldn't believe it. I could not believe it. You know, there was asphalt put over concrete that had these big stones in it that was done probably in the 1940s. And there was asphalt put over that years and years ago. And the asphalt was completely peeled away. The asphalt was thrown up into the woods. Still there was the concrete with the stone. And the asphalt was lying up in the woods. The power of the water was unbelievable. You know, but the power of West Virginians standing together, as they've done in this pandemic, was always there. You know, I'll never forget until I die how we looked for bodies and looked and looked and looked. And we finally found little Kayla Phillips, and we found her, 6 weeks later. And hold on just a second. But okay, I'm sorry, that's a different thing. But nevertheless, Kayla, it was terrible. Looking for a little 14-year-old girl that we found miles downstream. And I know the same was true all over the place. And I've been to many, many, many of those towns, almost every one of them. You know, we waded the mud. We saw, family after family after family, take all their memories, all their prized possessions, everything. And they were just piling them up out in front of their house. And the National Guard would come by with an end loader and just load them up and throw them in a big dump truck, and off they went to some landfill somewhere. It was terrible. It was just plain terrible. The work of the National Guard, BOAD, everybody, it was just unbelievable. But how we stood together, how we absolutely got through that, was because of just who we are in West Virginia. The same thing has happened with this pandemic through and through. I ask you absolutely to remember all those we lost and all those families that were impacted in such a negative way. And I absolutely ask you for your prayers always for those at that time that we lost, and as I do for all the prayers that I ask you for every time I come in front of you with this terrible pandemic. But I'm going to ask for your prayers for one other gentleman or young man that we lost, and we lost, the son of a delegate that we have here, and Delegate Walker's son, Demetrius, who a lot of people call Mac, and I didn't know the young man, 23 years old. It is a tragedy beyond belief to lose one of our young people. I talked to Delegate Walker, and as soon as I found out this news, naturally she's very, very, very just brokenhearted. And I ask for your prayers for her and this young man and all of the young man's loved ones. It's, I just can't tell you that when we lose a young person, I just can't imagine it. I just plain can't imagine it. I have the great honor to be with kids, coaching kids and everything, and it's my engine in a lot of ways. I don't go on vacations, and I don't because I love it here. I mean, why go somewhere else? But really and truly, when we lose a young person, it is just so tragic. There'll be a blood drive in his honor this Thursday from 1 to 6 p.m. right here at the Capitol. And again, it would be wonderful if a bunch of folks would show up and give blood in this young man's honor and to honor our delegate. So Delegate Walker, we love you, and we'll continue to keep you in our prayers. That's all I've got.
All right, thank you, Governor. We'll now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon, and in keeping with what the governor has said, certainly we continue to enjoy some of our statistics, our metrics that are still moving in the correct direction. We certainly see fewer hospitalizations and ICU cases than we've seen before. And as the governor said, one death is too many, but we have seen a reduction in the number of deaths over time as well. I want to just take a second to also extend our condolences to Delegate Walker and losing her son. That is always just a tragic event to have a young person die. So Delegate Walker, our love and thoughts and prayers are with you and your family. I want to touch on two things today, which I think are really important. You know, things are looking better in general across our country related to COVID-19. If you look though around the world, we see that South Africa is really having problems, and so is the United Kingdom. And let me just focus on the United Kingdom for 1 second. So not that long ago, the United Kingdom variant, the Alpha variant, was the dominant form of COVID-19 in the UK, and that now is the dominant form of COVID-19 in West Virginia, 100%. But in other parts of our country now, and in the UK, the United Kingdom is seeing now the Delta variant, the variant that came from India, accounting for 99% of the new cases of COVID-19. And when we look around our country, the Delta variant, the Indian variant, is starting to make America sick as well. Still about 10% or so of the total cases, but in unvaccinated parts of our country, like we're seeing in Missouri, the Delta variant is starting to infect Americans, and it's making those people infected sick, putting them in the hospital. And so as we start to focus on West Virginia, as the governor said, we have done really well as a state, and we're certainly, appreciative and grateful for the governor's leadership, but also for all of our citizens pulling together. But we also understand, and we're seeing across the world and in the United Kingdom, and in South America, we're seeing the Brazilian, the P1 variant, the Gamma variant, being the one that's really spreading and causing a lot of problems. And both those variants are starting to spread in the US. In West Virginia, luckily, we're not seeing a huge growth in the Gamma or in the Brazilian variant. We see a few more cases. We have 18 total. We don't see any growth in the Indian variant. We see 3 cases total. And we still see the dominant form of COVID-19 as the UK variant. But we know that's going to change. And that is with some certainty. And we know that unvaccinated people are really the ones at the highest risk. So we particularly want to send this message to our younger citizens, because nationally they are the group that is having the slowest uptake of vaccination. And we want people to know that by doing this for yourself, you're also doing this to protect your community, to protect others, to get back to doing the things that you enjoy doing, back to a regular life. And this is so important for us because we don't want to read more young people's names off the list the governor starts with. The other thing I want to focus on is we're starting to learn about some of the ramifications of COVID related to long-term problems that we are starting to see. And there's 2 studies that are coming out that should really give us some pause. First one is a study out of the United Kingdom, where they've looked at CAT scans and brain scans of people who have been infected with COVID and found those people that had brain scans before. And what they're finding is that the brains of people infected with COVID, and this is not people that got seriously ill from COVID or even had a lot of symptoms from COVID, but they're finding that some of the brain tissue has shrunk during their episode of COVID-19, particularly in the gray matter. And the gray matter of the brain is the part of the brain that houses all of the really important parts of the brain, as far as the cells of the brain, the part of our brain that actually makes us us. So we found that in looking at people who have had COVID, that their brains seem to be smaller than a comparison group where people had brain scans and didn't have COVID and had scans afterwards that matched about the same ages, et cetera. So that's something worth knowing. And we also know that, as we've said before, that many people report having a fogginess of their thought and not feeling normal as far as their processing, even as much as 6 months after having COVID-19. The other thing is there's a number of people now that are starting to present to medical places. This is a study out of Northwestern in Chicago for double lung transplants, because COVID in the lungs have made their lungs so poor that they now need to have double lung transplant to replace the lungs that were destroyed by COVID-19. So we really want to use this not to scare people, but just to try to help people choose to be vaccinated, because as the governor said, with all of the variants, the vaccines, particularly both doses of the vaccines, and we want people who have one dose but not two, please get that second dose. And 2 weeks after the second dose, the full dose of the vaccines, then people are very highly protected against really serious or life-threatening complications of COVID-19. So West Virginia, you've been a light for others to follow this whole time through. It's time for us to continue that position, but importantly, it's really important that for the future of our state, our young people also choose to be vaccinated. Thank you.
Thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good afternoon. We continue many mobile clinic efforts, and we'll continue over the next several weeks. In addition to that, we continue to press our work with groups such as AARP, the Healthy Grand Families Program, and the SSAC will also make another push for our young people to get vaccinated before fall sports. A lot of great work continues to go on. As the press conference started, I got an update from the Hospital Association on the numbers. We're now below 100 COVID hospitalizations. This is the first time since July 23rd, 2020, that we've been below 100. So I want to reinforce the point that the governor made earlier about the lottery and the prizes and those things. You want to be in the right lottery, West Virginia. You don't want to be in the one that puts you in the hospital, the one that potentially causes you to lose your life. You want to go out and get vaccinated if you haven't been vaccinated. And 18 to 29, 29 and to 50, we still have a lot of work to do. So we're asking all West Virginians to step up, get vaccinated, and help us get completely back to normal where we need to be in West Virginia moving forward. I want to take a minute too and reflect on tomorrow, June 23rd, the 5-year anniversary of that flood event. And as the governor did, just thank the many law enforcement, first responders, VOAD, and the team that they coordinated, of all the many volunteers from across various organizations in the state of West Virginia, to include the many ordinary citizens that the governor and I and others saw who just came in with food or supplies or whatever it was to help their fellow West Virginians. We should be proud of the way West Virginia responded to that flood, the way we took care of each other and our fellow West Virginians, and continue to drive forward. 5 years later, we still have work to do to recover from that flood. We will have the same challenges with our response and our recovery from COVID going forward. So please, West Virginia, get vaccinated, continue to drive forward, And to the Walker family, from my family, we will keep you in our thoughts and prayers, and God bless you. Thank you.
All right, thank you, sir. Secretary Bill Crouch with the DHHR is also joining us today and is available for questions. Dr. Aina Amjad, our state health officer, had a prior engagement today, and she will rejoin us on Thursday. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass from Channel 8 and Fox 11. Governor, coming on the heels of the Saturday drawing, we had a lot of people, a lot of winners, a lot of happy people taking the prizes that the state has awarded. I look at the numbers today for 12 plus at least one dose and 12 plus fully vaccinated for the population which is eligible, which you guys have figured out to be 1,557,837. One dose is a 62%, fully vaccinated about 52%. We've talked about it, but it doesn't appear, while those are obviously attractive promotions and the extra money for the younger people, the 16 to 35-year-olds getting the $100 was also something that you guys have tried. Doesn't appear that it's moving the needle very much, no pun intended. In my experience over the last couple of days and posting on Facebook, people, a large percentage, aren't going to get the vaccine for a number of reasons. Muddled messaging from healthcare experts, distrust of the government, feeling like the vaccine wasn't researched enough, et cetera, et cetera. You know all of them as well as I do. So is there anything that you can think of that will move this thing forward where we're going to get out of this area where we are, or is it just the way things are going to be? Thank you.
Well, Kenny, it's tough. I mean, that's all there is to it. If you just think about it, my MBA, my specialization was marketing advertising, and so I'm a human person. I mean, I'm a person that believes that human beings, not machines, and emotion and everything drives us in so many different ways. But here's what I think, and this doesn't sound very good. I think if you don't come up with all these promotions, you don't do everything, well, we're going to miss a lot of folks, because I think they've been very successful in their own way. If you try to evaluate their success and say, well, gosh, we surely would have thought we would have been getting, 1,000 a day, 2,000 a day, 10,000 a day by giving away what we gave away, and if you gauge it on a level like, that we were getting when everybody was scared totally to death and everything, well, then you could say, well, then they're not terribly successful. But Kenny, in all honesty, if we get an additional 500, if we get an additional 1,000, if we get an additional 20,000 and everything, how many lives have we saved? And how much money have we saved? How many hospitalizations have we saved? And so it just goes on and on. We got to try. We got to try anything and everything that's available to us. The federal government gave us the opportunity to make things like this available to us. And so you got to try. From the standpoint of the broadcasters and all the great work that they've done in putting it up over and over and over in front of people and in urging people to go get vaccinated, I thank them. I thank them so much. From the standpoint of all of our coaches, whether it be Coach Brown or Coach Nealon or Coach Huggins or Coach Pruitt, and all that they've come out and done, I thank them. I'm thankful for their little baby dog to be bringing a lot of smiles and joy to a lot of people and everything, and just thankful that the good Lord gave her to me, and we're Kathy and I enjoy her beyond belief, as do all of our family. But we got to try. Kenny, now listen, and everyone listen to me on just this. Here's the morbid part of the whole thing. Kenny, the only thing that I know of that would truly drive those that are absolutely sitting on the sidelines and not willing to take their vaccine, you know what would really do the trick? All of a sudden we'd have a landslide of problems with variants and they'd be dying like flies. That would do the trick, wouldn't it, Kenny? Well, God forbid, let's hope and pray that we don't get into that situation. But really and truly, at the end of the day, if a bunch of folks that hadn't had their vaccines started dying, a bunch of them, you'd see a real response. We wouldn't need to be giving away lifetime hunting and fishing license or trucks or whatever it may be. You'd see people running to get the vaccine. They ought to do that. There's two lotteries that are really going on right now. There's a baby dog lottery that's going on where they can win a bunch of prizes and everything, and it's a goodness type lottery. The other lottery that's going on is the death lottery. That's all it is. It's the death lottery. You know, the thing spins. Brrr. Are you one of the ones that haven't been vaccinated? Brrr. And it comes to your number. That's the other lottery, the death lottery. And let's hope and pray that I don't want a bad thing on the planet. I'm trying with everything I have to see that nobody else faces this terrible thing that they've lost a loved one. You know, but Kenny, it's a crying shame that we've got to come here and plead with people to go get vaccinated when we know how safe these vaccines are and how effective that they are. And I'm not a doctor. You know, I don't profess to be that at all. All I can do is report to you the truth and report to you really what's going on. But Kenny, it's just as simple could be. We got to keep trying. We got to keep trying to do every single thing that we're doing. And just to say, well, they're not really effective, don't just forget about it. Well, I'm not willing to do that. I'm not willing to do that at all. I'm going to keep trying, and I'm going to keep, you know, thanking people that have stepped up and either gotten vaccinated or stepped up and helped us get more people vaccinated. And I'm going to just try to tell the truth. And the truth is just as simple as this. You either got a baby dog drawing or a death drawing. You pick a winner. You pick a winner. You can sign up for either one of them, but that's what people are doing. You know, they're either signing up for the baby dog drawing because they've gotten vaccinated, or they're signing up for the wheel of fortune to spin and it spin their number, and then here we go into something that's really bad. So that's about it. That's all I can do, Kenny, is tell you what I think, tell you the truth as best I can.
All right, thanks, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I wanted a little update on the other incentive, the gift card / savings bond incentive. I know the deadline to register for that was Sunday. So how many total people did we end up getting to register for that? And how long will it take us until we get all of those people their gift card or savings bond? I still haven't seen any reports on social media or anywhere saying that anyone has yet to receive one of those. Thank you.
You know, Charles, I'll double check. I hope that's inaccurate. You know, I know we were sending stuff out, at least I was told, and I can give you what I think is the number. I think the number is around 40,000 that were that took advantage, or that we had in the system or whatever, that took advantage and are going to get those gift cards or those savings bonds. I think that's right. And you know, where we projected that the cost would be 20 million plus, I think the cost on that's going to be about 4 million. So I don't know exactly that's exactly right, but our people are checking this. Just 1 second. You know, they're telling me that the gift cards and the bonds, you know, have been going out, and that is have been going out. So and they're going to continue that, but I think we've moved right along on that, and I think it's 40,000 is the number, right, plus or minus.
All right, thank you, Charles. Next, we'll go to Annie Moore with WVVA.
Good afternoon, Governor. Basically, we've had an employee get a letter from Workforce West Virginia saying that there'd been a data breach at Workforce West Virginia in some cases of identity theft. Is this new and different from what happened in 2020? Is there a new data breach? And if so, how many people have been impacted?
I think, yes, there is a new data breach, and we have, I guess Scott Atkins, is he going to give us an update on that? Is he on today? But we'll get you an update on that, Annie. But Scott Atkins with Workforce will know a whole lot more about that than I.
All right, thanks, Annie. Next to June Leffler with West Virginia Public Broadcasting.
Good morning, Governor and panel. The question is for Dr. Marsh. So I was wondering if you could give us any studies or other evidence out there that suggests that us getting rid of our mask mandate right now is an okay thing to do. We are not the first state to get rid of the mask, and there's always more studies that are coming out. So just give me a sense of what is the evidence out there that says, yes, getting rid of masks now will not necessarily cause some sort of spike in cases. Thank you.
Dr. Marsh, please go.
So the data that we've talked about, June, on several previous press briefs is really the data that is being used. As the governor said, for people that are fully vaccinated, even against the more concerning variants that are moving toward the US, we know that there is a substantial protection, 96% against the Delta variant or the Indian variant for fully vaccinated people. And most of those studies were done with Pfizer. The projection would be that Moderna would be the same. The Johnson & Johnson vaccine is perhaps just a tad bit lower, but still certainly in the 92% or higher range to prevent any serious infection. We've talked a lot about the benefits of being vaccinated. We also know that, as the governor's managed this pandemic so well, that for people who are vaccinated, they, are in following CDC guidelines, are now, with lots of scientific evidence, they should feel safe going without their mask, particularly outside in indoor environments where there's mixed people. Then certainly, I think for me at least, I would still wear a mask, even though I've been fully vaccinated. And each one of us should make those precautions ourselves. When we look at people that are unvaccinated, we do understand that the risk of getting infected and infecting others is still, substantial, and maybe even more substantial with the new variants coming, particularly the Delta variant. So we would encourage those people to maintain caution, to choose to be vaccinated. That's absolutely the way that you can protect yourself and protect others. But that's the reason why, if we're in mixed, groups of people, particularly indoors and crowded environments, I think that it still may be safe for us to choose to wear a mask at the individual level. But, as the governor has, committed and done from our state's birthday, and as the country plans to do in July 4th, then this now becomes really a decision and a choice by each person. But being vaccinated and being 2 weeks after your final vaccine provides an exceptional amount of protection, whereas not being vaccinated puts you at high risk, particularly with the Delta variants that will become more prevalent in the US.
All right, thank you, June. Next to Michael Baldwin with WDeep-TV.
How are you, Governor? Hope things are well. So my question was already asked by Ann Moore in regards to workforce, but I did want to ask a follow-up to that, and just knowing Can we find out how many people were affected by this as well? Do we know why Workforce did not send out a press release alerting the public to what had happened? And as a side note, sir, one of my producers would like to know, why did you choose the name Baby Dog?
Okay. I can answer the baby dog part real quick, but let me go back and tell you that on Thursday I'll have Scott on here, Scott Atkins, and he'll go through every little bit of it on Thursday, and if prior to Thursday we can get to more of the details and from him, going out in a and with a press release and everything, we'll get the details immediately and get out something on that, as well as have him on here on Thursday. As far as Baby Dog, how we selected the name, I think that was a question and everything. It is really just as simple. Christmas before last, my son and daughter walked in. We had 2 little Boston Terriers in the house. Since that time, we've lost one of them and everything. She was pretty old and everything, but hated like crazy because we take our pets as seriously as just we just think of them as children. They're just really precious to us, and especially I just love little dogs. That's all there is to it. But nevertheless, we had 2 little Boston Terriers running all over the house and everything, and our son and daughter walked in on Christmas Eve night, and just reached over my shoulder this English Bulldog puppy. Well, our grandson, his name's JC, he was running around there everywhere and everything, and he had just turned 2 years old. And so the little puppy's running around and everything, and he kept walking around saying, now he's just a little baby himself, he's just 2, but he would walk around and say, where'd that baby dog go? And so it stuck. And so from that point forward, that little English Bulldog puppy was Baby Dog. And so that's where she got her name.
All right, thanks, Michael. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. I wanted to follow up on the vaccination incentive lottery question. According to the DHHR, so far for the month of June, the state has administered 27,040 doses, and in the past week, that's dropped to 5,298 doses. So it appears that rather than incentivizing getting vaccinated, the vaccination rate is dropping off pretty precipitously since the lottery was announced. Considering this will cost more than $10 million in taxpayer money to complete the lottery, would there be any thought, if the numbers don't improve, to calling it off at some point?
Phil, let me ask this, and you try to answer this question. If we've dropped down to 5,298, how many would we have if we had no lottery? Pick a number. 2,000? Then tell me this. What are those 3,298 people, if we drop to 2,000, what are those 3,298 people worth? What's the hospitalizations worth? What's the continuation of all the testing and everything worth? What's it worth? Really and truly, you can't do that. And in my opinion, wholeheartedly, we got to continue to try. There's no reason whatsoever to call off what we've got out there and what we're doing. State after state after state is doing exactly the same thing or even more than what we're doing. And it is taxpayers' dollars, but it's coming from the federal government. It's not coming out of our pocket in West Virginia. This state is in great hands and is doing absolutely great. Not by you, but by others that are making this happen.
All right, Governor, I'll turn it back to you to close out.
Put that back up. I'm sorry. Okay, coming back to me. Okay, just in the end, I would go back to just this. And this sounds terrible. I mean, this is absolutely sounds terrible, but you count on me to tell you the truth, do you not, over and over? And I think it just really boils down to this. And if you're a young kid or if you're a 99-year-old, you got to listen to me. Really and truly, and if you're a young kid and everything and your grandma's not vaccinated or your dad or whatever's not vaccinated or your dad is there and a child is not vaccinated and they're saying, no, I don't want to do this. Remind them and absolutely encourage them. Absolutely come on and help me. You got to some way help me. You've got to tell them that they are in a lottery. If you're vaccinated, you're in the baby dog lottery. You're in the baby dog lottery, you're winning and you're safe and you're going to have good things in life. If you're not, here's where I got to have your help. If your dad has not taken the vaccine and you're one of the children, talk to your dad. If your granddad or your grandma has not taken the vaccine, talk to them. If your child has not taken the vaccine, talk to them. And you got to tell them. You got to tell them they're in a lottery too. They're in a lottery that I show every time I walk in here. And I'm sick and tired of showing this. I want this to be nothing. I want it to be zero. I want it to be zero more than you'll ever in your life know. I want this to be zero. But they are in a death lottery. That's all there is to it. They're in a death lottery with a bunch of West Virginians that have not taken the vaccine. And when the lottery thing spins, it's going to hit somebody. And it hits more than one, over and over and over. And we got a choice. We got a choice. You're the baby dog lottery or the death lottery. Pick a winner, but you got to help me. You got to help me. You got to help me convince everybody, every single one of those people, to go get vaccinated. Get in the baby dog lottery. Get in with all the rest of us over here. Absolutely don't be in this thing to where we got to read these names. Let's stop this. Anyway, I love each and every one of you more than you'll ever know. And absolutely, I mean that. I don't blow smoke at anybody. I really mean it. I really mean it when I tell you I love you. This state it just abounds with the greatest people in the land, the absolute best. And so come on. We have done so good. We have done so good. And if I encourage, and I don't care, I could give a hoot about Phil Kabler and trying to convince you, oh, we shouldn't do this, we shouldn't do that. I would love to see what Pee Wee would have decided to do in this position. Honest to God, it would have been the god-awfulest mess you've ever seen in your life. But with all that being said, really and truly, I don't care what he says. We're going to keep trying. We're going to keep trying, and we're going to get there. Just keep at it, West Virginia. Keep doing the good stuff. God bless each and every one of you. I meant it when I said I love you, and I'll absolutely do that to my grave. Thank you so much.